Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Abnormal sexual development XX karyotype. A female with karyotype XX but external genitalia looking like male. There are five differential diagnoses for it. 1. The most common cause is congenital adrenal hyperplasia, which is by 21 hydroxylase deficiency, 11 beta hydroxylase deficiency, 3 beta hydroxysteroid deficiency. Most common is 21 hydroxylase deficiency. Second, true hermaphrodite or ovotestis. This can also occur. Third, aromatase deficiency. If there is aromatase deficiency, actually androgen gets converted to estrogen in the presence of aromatase. If there is aromatase deficiency, then obviously there is abnormal sexual development. Fourth, maternal androgen drug excess. Fifth, pregnancy luteoma, or that is excess maternal androgen production. So all these are the causes of abnormal sexual development.
Abnormal sexual development in males is always associated with increased androgens as seen in all of these disorders.
thank you and thank you for watching.